Be recorded.
You all rise, we'll stand and pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We'll call this meeting of the Central Nevada Health District to order. We just pledged allegiance to the flag. I'm Mayor Ken Tedford, and I'll ask us to go to item 3 to verify the posting of the agenda. Has it been posted in compliance with NRS?
Yes, Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 7th day of February, 2025, between the hours of 12 p.m. and 5 p.m. at all the locations listed on the agenda.
Thank you. Amber, at this time, could you take roll?
Chair Ken Tedford,
Here.
County Manager Jim Barbie, Justin Heath,
Here.
Bob Erickson,
Here.
Denise Ferguson. She's on there. Don Witten. Here. Brandon Chaddick,
Here.
Jeb Rowley,
Here.
Rich McKay, Connie Gottschalk. Here. Tony Roos.
Here.
Okay, that sounds like we have a quorum. So we'll go to item 5, which is public comment, which must be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Mr. Clifford.
Good afternoon, Mr. Chairman, board members. Hope everybody's well today. For the record, Bob Clifford from Fallon. The news isn't getting any better. There's a tsunami of excess deaths. I mean, it's bankrupting the life insurance companies, and they're refusing to pay, saying it's experimental, you shouldn't have taken it, you died due to the vaccine. I got 10 pages of article links attached, and I sent Amber the PDF file so you could click on it. If you get the file, you can go to view the articles without having to type it in. But it's going to destroy the insurance companies, it's going to destroy the economy, it's going to destroy society. They're forecasting billions of people dying in the within the next few years. The articles, if you go through them, devastating. Prosecutions for genocide, peer-reviewed studies of things like turbo cancers, complete loss of fertility. It's really bad, and you'll find most of these not showing up in the legacy media, who are funded either by the government through, interestingly enough, USAID, just uncovered by Trump, and DOGE, and the drug companies through their advertising. Large numbers of doctors and even nation states are calling for a ban on the vaccine. In fact, there was a congressperson today that demanded they be revoked immediately, and prosecution of those responsible. And all the conspiracy theories turn out to be true. We'll know more. The FDA has been ordered to release a million pages of evidence that they were trying to hide. NIH admits that the vaccines are behind the global surge in excess deaths. Pharmaceutical whistleblowers say they were designed to intentionally cause harm. Military apparently is responsible for the original development of it in 2017 as a weapon. There are products on the market that can protect you to some degree. Things like nattokinase will destroy spike proteins. There's a lot of other ingredients that can be helpful. One product, an article on one product's in the attachment. Also, it turns out that all these turbo cancers, it turns out that ivermectin and a couple other antiparasitics are proven to be extremely effective treating cancer. And, you know, that's upsetting the pharmaceuticals because they wanted to sell cancer treatments, and ivermectin doesn't make them any money. Anyway, welcome to being ground zero for the bird flu. I'm sure you're aware what's happening in the county. Bill Gates funded making the bird flu transmissible to humans. Gee, I wonder why he did that. So far it's not dangerous, but what better place to release a variant that is deadly to humans than in a place where it's in the, you know, in the dairy population, in the cows. We're ground zero. I mean, I would be on the lookout for somebody to, you know, drop a deadly variant in here that's been engineered in a lab and then try to blame it on God knows what. And finally, I agree with Tucker Carlson. I don't think you can trust any doctor or medical institution that still recommends COVID vaccines. They're neither safe nor effective. In fact, they're extremely harmful. And to continue to recommend it is gross negligence, in my personal opinion. And lastly, we have some really good news. RFK Jr., who is going to try to help us get healthy again and get out from under all these drugs, has been confirmed by the Senate to be the HHS secretary, and that's fantastic news. Anyway, thank you very much for your time.
All right, thank you. Is there any other public comment? Okay, being none, we'll go to item 6 on the agenda, the consideration of possible action, approval of the minutes of the meeting held on January 9th, 2025. If there's no corrections or additions to those minutes, I'd entertain a motion to approve those.
Brandon Shattuck for the record. I'll make the motion to approve.
We have a motion. Do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and the minutes have been approved. We'll go to item 7A, consideration and possible action concerning approval of a notice of a subaward between the Office of the State Epidemiology and the Central Nevada Health District to start a new partnership in the amount of $10,075 from 11/1/24 through 2/28/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is a grant, again, we received from the state. It helps really to help with our ongoing efforts in our epidemiology program and our disease investigation and case management program. This is helpful for to increase our use of what we call the EpiTrack system and capture all the required information that we need. Again, helps with ongoing efforts that we're already doing, just to supplement that ongoing effort.
Okay, any questions from the board or the public for Darren on this subaward? Being none, then back to the board for a motion.
Mr. Chairman, Bob Erickson for the record. I would move the approval of the subaward between the State of Nevada Epidemiology and the Central Nevada Health District to start a new partnership in the amount of $10,075 from November 1st, 2024 through February 28th, 2025.
We have a motion, do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion, a second, all in favor?
Aye.
Aye.
Opposed? None opposed, the motion carries, and that subaward has been approved. We'll go to item B, or 7B, consideration and possible action concerning approval of the notice of a subaward between Immunization Office of Child, Family, and Community Wellness and the Central Nevada Health District to perform activities deemed effective in planning for and implementing COVID-19 vaccination services in the amount of $154,894 from 1/13/25 through 6/30/25. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is a grant with some COVID-19 dollars that the state found for us. As you know, it's short-lived. It will go through June of this year, so about the next 6 months. The biggest lift on this particular grant for us, which is a good thing, we have some equipment and contractual costs in there. That cost is built into buy some generator-type equipment for the new building. And so we're excited about that. That'll allow for, if the power goes out, those generators will kick on. Basically, the protection of all of our vaccine, not just the COVID-19 vaccine that we have. But so that's kind of the largest part of this grant. Again, just some leftover money, I guess, for lack of a better way, that the state found, that we found some good utilization for. With that, I'll turn back to you, Mr. Chairman.
Okay, does the board or the public have any questions for Darren on this subaward? If not, back to the board for a motion.
Mr. Chairman, Bob Erickson for the record. I move that we approve a subaward between excuse me, I'm off my sheets here. Between the Office of Child and Family and Community Wellness and Central Nevada Health District to perform activities deemed effective in planning for and implementing COVID-19 vaccination services in the amount of $154,894 from January 13th, 2025 through June 30th, 2025.
Brendan Chaddock, for the record, I'll second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and that subaward has been approved. We'll go to item C, consideration and possible action concerning approval of the fiscal year 2026 annual base rate fee and the annual per person capita fee for members of the Central Nevada Health District as follows. Annual base rate fee for each member equals $100,000 per person capita fee. City of Fallon, $47,755. Population of 9,551 times $5. Churchill County, 89,945. Population of 17,389 times $5. Pershing County, $28,920. 5,784 population times $5. Mineral County, 24,410, a population of 4,842 times $5. And Eureka County, $8,880, 1,776 population times $5. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is the funding responsibility for the district is allocated, as you know, between the district members. There is the annual fee owed by each member of $100,000, and then the base or the per capita rate is determined by the population of each county times $5. The numbers you see in front of you in terms of population are from the latest state demographer's report approved by the governor's office. So that's where those numbers are derived from. There's a little bit of difference in Pershing County as we subtract some of those numbers from your inmate population from the prison system out there. So those numbers that you have in front of you have all been evaluated by your comptroller's office and have been approved by their offices. So with that, Mr. Chairman, back to you.
Any questions of the public or the board for Darren on these figures? Other than how he explained those slight adjustments. Okay, I would entertain a motion, and I think you could probably make the motion from the subject title that I read without rereading. I think I could shape the motion that if someone would be willing to make the motion as the chairman read the subject title of a motion to approve the fiscal year 2026 annual base rate and the annual per person capita fee for the members of Central Nevada Health District, as the chairman had read those into the record previously. Would someone be willing to make that motion?
For the record, Dawn Witten, I make a motion for the approval of the fiscal year 2026 annual base rate fee and the annual per person capita fee for members of the Central Nevada Health District as follows. Numbers per the chairman's motion before.
Yeah, I think that's fine. We have a motion to that effect. Do we have a second?
Justin Heath, for the record, I second it.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. And fees on 7C will be established as the chairman read the subject title into the record and the motion was made as therefore. You understand that, Amber? Okay, we'll go to 7D, consideration and possible action concerning approval of the Central Nevada Health District's tentative budget for the fiscal year beginning July 1st, 2025 and ending on June 30th, 2026, as submitted, revised, and requests that Churchill County Comptroller provide the necessary documents to the Board of County Commissioners and to the Department of Taxation as required by Chapter 354 of Nevada Revised Statutes. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman. This is, the tentative fiscal year 26 budget for the district. It's been an interesting year or an interesting time in developing this budget. You should have in front of you some of the forms that we're required to fill out. Overall, we're looking at a pretty flat budget in terms of what we think we're going to generate in revenue and what we're going to get from our state partners in the grants that we receive. And in this particular request, we're not asking for any new positions. We're basically going to stay whole with what we have now. And we are going to lose one of our key players. Our clinical manager is moving on. And so we've opted most likely to hold that position open for a little bit until we see how that looks moving into FY26. But we feel we have the kind of horsepower, so to speak, to meet the demands that she was doing and continue the work that we're doing and not miss a beat. And so we'll reevaluate that again, like I said, sometime in maybe mid-year FY26. We are, so far, we'll keep our fingers crossed. I don't know if I should say too much because I don't want to jinx it, but the governor has put into his budget $15 million for the health districts. It was extenuation of or extending of SB 118 funding, so that's going to hopefully help us. Doesn't give us a lot of money, but it's certainly helpful as we try to balance our budgets. In this particular budget cycle, we do have some capital outlay that we were asking for in just shy of $300,000. That will be looking at building out the infrastructure, as we've talked in the past with the new building that we have, looking at all the IT, data cabling, all that kind of infrastructure that goes into a new building. And so that's what we're kind of keeping that money. That's from two separate grants that we have, and so we're kind of holding that back until we see what's going to go on with our new building. I believe, and I don't know if the county manager's on, but I believe that went out to bid. So we're hopeful to be looking at some construction going on and building that out here in the next several months. So I'm happy about that. Overall, if you look at the spreadsheets that we have, if you look at the expense versus, I can find my revenue sheet. Basically, we have a revenue of just a little over 2.6, almost 2.7, and we have an expense of about 2.6. So we're pretty close. We're going to hopefully have a little bit of savings as we move forward, but we feel that that's a pretty conservative budget. It looks like we're in good shape moving into FY26. As you all know, that is contingent upon, obviously, the grants that we get from the state, and that could be less, could be more. Just as that moves forward, we'll know more as we get into FY26. But I'm comfortable with where we're at in my own. I think Shasta, I want to give a big shout out to her. She came forward and helped us, balance all this and get all the numbers together and keep us whole with the state and all that sort of thing. And so couldn't have done it without her, but overall, we're, I think, in a good spot. Mr. Mayor, or Mr. Chairman, I'll turn it over to you.
Okay, does the board or the public have any questions on this budget that Darren has prepared?
Mayor Tedford, Brandon Shattuck for the record. Questions for Administrator Winkleman. I see that electric and water sewer utilities has an odd fluctuation from actual versus budgeted. Is that for the purposes of balancing the budget?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Mr. Chaddock, are you talking about the year-to-date number?
Yeah, so it looks like previous expenditures didn't exceed $2,000, and then 25 was budgeted 30,000. Year to date, if I'm reading right, is 2,600. So historically, it's never exceeded 2,000. Clearly, it's gone up for year to date, but is the 18,000 cushion there just to balance?
A majority of that is, so before we were in the building that we're in, the county paid for those services, so all the electric, gas, in the building we are in Churchill County. That has changed now since social services has moved out of that building. We now are responsible for a third of that, I believe. Shasta saying, yeah, a third of that. So that's where that number fluctuates so much year to date. We really weren't paying anything to where we're going to pay quite a bit more now. And that 18,000 is based on the numbers we've been seeing for the last, I think we've been paying now for the last several months. We have now a better idea what that's going to look like, and that's where that number is budgeted from.
Excellent, thank you.
Okay, thank you, Brandon. Any other questions? And no public questions? Okay, back to the board for a motion to accept this budget.
Mr. Chairman, Bob Erickson for the record. I move the approval of the Central Nevada Health District's tentative budget for fiscal year July 1st, 2025 through June 30th, 2026, as submitted and revised, and request that the Churchill County Comptroller provide the necessary documents to the Board of County Commissioners and to the Department of Taxation as required by Chapter 354 of the Nevada Revised Statutes.
Chairman,
Do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion, and a second, all in favor?
Aye.
None opposed? The budget for FY '26 has been approved. You know, there may be some other tweaks you're gonna have to make on this budget when you move into that new building too. Because pretty hard to forecast that.
Can you repeat that? I'm sorry, Mr. Chairman.
When you move into that new building, you know, you're gonna, it's gonna be pretty hard to forecast some of those costs in that new structure when it gets done. You know, I'll just take electric utilities and water and sewer, that it may be more efficient, it may be, it's bigger than what you're in now, and you know, you got it upstairs, downstairs. I don't know what that's gonna be just in that. You're hooking up all new IT. You know, I don't know what that will be, whether that'll be a savings or whether it'll be more, you know, to run all that stuff, just looking in that one line. I think that'll be interesting when you get in there.
Mr. Chairman, members of the board, for the record, Darren Winkleman, I agree. We were able to, I guess, kind of look at the crystal ball a little bit in terms of the building next door to us, who is now occupied by Churchill County Social Services, and try to, it's a similar layout, and we've been looking at their ongoing kind of utility costs. Just ultimately depends, I guess, how big we end up building out and what it all looks like overall, but we're trying to predict that a little bit.
Okay, thank you. We'll go now to item 8 is public comment. That was 7C that we just did. So we're on item 8, or that was 7D. We'll go to 8, public comment. Is there any public comment? General in nature, not relative to any item on the agenda today. Being none, we'll go to staff reports. 9A, we have a written report from the health officer. It says no discussion, but if there's any public comment, we certainly would take it. Some of us were pressed for time with another meeting that we had to go to, so Dr. McDonald was just going to do a written report today. I see Jim already went to the meeting, but so no comment, no questions. So we'll go to item 10, which is adjournment, and there's nothing left for us to do today, but we're stand adjourned. All of you who traveled here today, have a safe drive home in this weather, and those of you who are on the other side of this, thank you for being on the phone today. We appreciate it very much, and all of you have a nice Valentine's Day tomorrow. And don't forget to get your special person something. All right, thank you very much. We stand adjourned.